Assalamualaikum warahmatullahi wabarakatuh. Hello everyone, my name is Hanif Prahita. Right now, I am pursuing my master degree in communications on Faculty of Social and Political Science, 11 Maret University, Surakarta. On this paper, I'm joining with Mr. Has and Mr. Sudarmo, both of lecturer of 11 Maret University of Surakarta, in the occasion of the 6th International Conference on Social and Political Science, ECOSOPS 2020. The title of my research is Health Communication in Mitigating the Risk of Physicians and Control COVID-19 Outbreaks, Qualitative Study on Emergency Departments General Practitioners, or GP. The introductions, doctor as the front line of detection of patients infected with COVID-19 have high risk of transmissions. However, the ability of doctors to provide proper communications with a unique medical interview process and persuasion of health context are needed so that patients will be open and honest about the symptoms of the illness and get the required information as preventions. So the purpose of the study was to determine change in doctor-patients communications and how information can reduce the doctor risk, and by delivering health communication to patients and their families, hopefully it can increase awareness of the outbreak, change behavior, and build a resilient society during the COVID-19. The literature reviews is breakdown by three parts. The first one is interpersonal doctor-patient communications as part of health communications. Based on research conducted by Ha et al. And at 2010 shows that most complaints about doctors are related to problems of communication competence, not the clinical competence ones. On the other hand, Ong et al., which found a positive correlation between good communication doctor and patients, can effect a lot of positive things from the patient's view. The second part is spatial communications. We have four model of doctor-patient relationship by Emmanuel. Usually, the ideal relationship is mutualistic one, whether the doctor will direct treatment and make decisions about treatment, where decisions about patient treatment have been approved in advance by the patients. But Emmanuel have forced different understanding. So we try to comply this research. The last one is health communication, developing on behavior change and with a relation society is consists of 8 parts by Rahmadiana in 2012. But we're focusing on the number one, the relationship between medical experts, and then individual adherence to the treatment process that must be undertaken is the point three, and the last one is this dissemination of information about health risks of individuals and populations. The methods, this research method use a case study qualitative research, and then we using the phenomenon one because we want to know more about the attitude, behavior, motivations, and actions to get comprehensive and in-depth picture from the perspective of the participants and the study. And then we data collection using the literature reviews, analyzing any information through the media, non-participatory observations, and the last one is the interviews using the Google Forms conducted from June to August uh, to know more experience, change, the limitation informations, and the obtain information according to specific purpose. The data collections involving 14 doctors and 14 patients, and with the validate the data because as we know a lot of research before using the patient centers perspective on this interpersonal things. The results and discussions, doctor considered as someone who competent. So Indonesia's patients think that every doctor must be spread the information, the right informations about the COVID-1, because doctors who competent and has credibility in health sectors plays an essential role in conveying information. So the trustworthiness of the information obtained by the public, and this is in line with the Dunning-Kruger effect theory in Buana 2020. People must have sufficient knowledge so that they can comply with and implement government recommendation optimally and adequately. So uh, doctor or medical expert have the part and the significant part of the spread of informations. And then the study have indicated to detailed information is needed regarding the preventions, transmissions, and the risk of COVID-19, whether we must to have necessary to cultivate the habit of clean and healthy lifestyle or PHBS, and then changing attitudes don't always involve the same psychological process as changing behavior. And Indonesian people still likely to agree with persuasive message than with using like the other one or using violence. And the conclusions of the research, we have three. The first one is change in communication in the history taking stage were found in the interviews of this study have three of chains. The first one is providing and seeking informations. Number two is verification of informations on medical consultations. And the last one is socio-emotional communications also chains. Meanwhile, in providing information related COVID, in medical point of view, the best formula is using the comprehensive regarding how to prevent, spread to the risk pose so that it had impact on the trade. The last one, the change, the pattern of doctor-patient relationships that we propose on the research. If the other research on this daily base using mutualistic, in this research, we propose to using paternalistic form to be more effective in spreading the informations. Okay, it's enough from me for our presentations. For your attention, we say thank you and wassalamualaikum warahmatullahi wabarakatuh.